Hello? I lost my voice, so I'm not going to be talking too much. I'm going to pass it on to Ryan over here. But when it comes to digital healthcare stuff, we think we have a good solution. Oh my God, I sound like I'm going through puberty. All right, wrong crowd? Okay. So, but before we get into some of the things that we think we have a solution for, we wanted to show you some data on what the actual end user, in that case, consumers, are thinking about all this kind of technology that's out there. Sometimes we come up with really good things. However, if nobody's using it or the engagement isn't good, what good is it? So we just want to show you guys some stats first. And, yep, next. Thank you. So the pandemic obviously changed the culture of how people look at technology when it comes to using healthcare. And we're just going to throw up some data here and show you what people are actually looking at. Okay, I can't do this. Dear Lord. Ryan, you're going to have to talk. I can't talk. All right, go.
Totally prepared for this, right? So just so you all are aware, I'm usually the Vanna White, and he's Pat Sajak, does most of the talking. I just stand there and point and click buttons. So now you get to listen to me for a change. But anyways, little humor, hopefully break up the day. But what we would like to do is share with you the statistics that come from the public, because we can tell you how great we think things are, but the data backs it up quite well. So what this is comparing pre- and post-pandemic thought on digital and virtual healthcare solutions. So this first one here is very simple. I'm worried about my physical health deteriorating. There's your age groups. The blue line is the before. The green line is the after. As you can see, it's fairly significant increases all the way through from Gen Z to the baby boomers, which is probably the ones that will take the longer to adapt to the new healthcare. The younger people, obviously, much younger than me, gravitate to their devices first. The older generation, like myself and those older, we're going to have to teach them new ways, because that's what's going to make all of this come together. The next two statements, if you can't see them, I'm comfortable with the growing use of technology for managing my health, and I trust the use of technology for managing my health care. It's pretty significant increases again, and I think most of the people in the room are focusing on digital and virtual care solutions in their business. These are the trends that we should be focused on together, because the people that take advantage of this opportunity, where people are willing to adapt their way of doing things by adding technology, because public has been shut down and most likely will be the next time we face something like this. It's an opportunity for you all to really take your business to the next level. So here it says, would you use apps, websites, or online forums to gather information about your potential symptoms and care options? WebMD, all of those types of services, very good numbers there as well. Here we asked, would you buy gadgets or devices to help track your health for exposure and predispositions to disease? Again, almost half of everyone, except for the older generation that's still getting there, are willing to try. And that's what we need to get digital technology to that next level. So, percentage of consumers would agree with the statements below, ranging from would you prefer to take medicine orally over using a needle, to I prefer to get prescription medications delivered at home. For a first visit to your doctor, would you prefer interacting remotely with voice or video? That's a huge increase of 11%, and that is the stuff that we're really excited about, because that means the public is just as ready as we are to bring healthcare to the next level. So the takeaways: with the many options in the marketplace to choose from, how do we implement the right technology, right? That's a very hard question. From our own experience, we can tell you that no matter how easy it is to use, it's getting them to actually try it that is the hardest part, right? So we've got some pretty good ideas on how to do that. That's what helps make our solution a little bit more unique, and we'll get to that later. But what makes this time in history as unique as it can be is the data shows now people are more apt than ever to actually try something new. The digital care options, the virtual care options really have come to the forefront. And if you adapt and you find the way to connect to your customers, this is where you're going to really explode your business and your potential. So the one way that we really find works in our solution is a good old-fashioned bribe. We reward you for using our technology. And that's really what has gotten our engagement to the point where everyone that enrolls in our program is compliant to the rules of the program, so they're using it. That's really what we're doing, is driving them to the usage. And we do that through tax savings. Anybody that pays too much in tax, which is everybody, I think, personally, would like to save money if they can. We show them how to do that through healthcare, using technology, and that's opened the door for them. So, you want to take the spin around the wheel? You got a minute? No, you still no go? All right, so technology that is used by consumers to bring value. What are we going to put together? Well, our wellness program and wellness solution brings together a whole bunch of things. Telemedicine, obviously, price transparency tools, whether it be a map where you can find an easy urgent care that's actually affordable to use, or you have an unfortunate diagnosis or need a surgery and you're looking for the lowest cost or best option in your area. We have all of that available through our technology as well. We incentivize them, just like I said. Not only do we incentivize them by saving them money, which is a good motivator, but we also take out the hard parts of the process. So for claims reimbursement, anybody in that avenue, it's completely paperless. All of it takes place on the platform, and there's no bringing your doctor's bill to the HR department or to your payroll to get reimbursed. We take care of all of that for them. The FICA savings, that's what I talked about earlier. We're going to show you ways to take advantage of reallocating some of the federal taxes that employees have taken out of their check. And we also monetize the process. So people like to be rewarded. Think of all your favorite little apps and the reward programs that you're on, and they give you points and they send you little awards and badges and all of those fun things. We do the same thing, except we monetize it. When somebody quits smoking, when somebody loses 3 pounds or cuts their sugar intake or improves their sleep, our app rewards them for it and says, hey, you're doing a great job, but it also quantifies that to a dollar amount. If you lost 10 pounds, it saves you $30,000 on your lifetime healthcare spending, and puts it right in front of them so they can see it. And people do get motivated by instant feedback, instant reward. It's very, very easy for them to get excited about. So what else can you do with it? I would take my money that was going to be paid in taxes and I would put it into retirement, because I'm going to have to pay for health care. I haven't lost those 10 pounds yet, so I still have the $30,000 extra that I will need to come up with, and that's where it's going to come from. So the robust benefit offerings is where everyone in this room can come in, because that's where your technology integrates with ours. We're a door opener. We're the pretty splash page. People register and log in. You all are the technology providers, the care providers that they access through our portal and use the benefits that you all offer. So what does that look like? It's integrating our technology into yours. And how do we do that? Well, our program takes care of the gamification, it takes care of the storing of information, and it takes care of bringing your technology to the fingertips of our customers so they can access it and you can take over from there. I like the time. So
It's supposed to be fast, right? What are you going to do?
Go ahead. You got a second. Go ahead, take this one.
Well, just actually keep going, and then we'll show you actually how the app works. Yep, keep going. And one more time. All right, now you can go. This is all you still.
So a multi-tiered approach to wellness and tracking long-term results. What does that look like? Healthcare education. We have a digital library so that people can not only just find the care they can educate themselves about the best options. People that become educated learn more about access and quality that way. We obviously have all of the tools, including digital health assessments, disease management, self-study videos. All of that's going to be included in the platform. Access to healthcare. Not only the virtual care solutions, so you do have the 24/7, 365 support that you need from professionals. You also have the tools to find those professionals. So if you don't have a therapist, if you don't have a surgeon, and you need one, not only can we help you find one based on quality, but we can also match it to price. That leads right into the healthcare savings. Obviously, the affordable locators are great. But what happens if you've already had a hospital bill? What happens if you are already dealing with a diagnosis and something's changed? Well, we offer help through Medicaid to get financing for people that would qualify. That's going to be anybody under 4 times the federal poverty limit for income. Anybody that thinks that might be too low for a family of 4, that's going to be around $125,000 a year. So it helps a lot more people than they realize. And there's people struggling to pay back hospital bills of $10,000 or $20,000 from a very unfortunate health event, and we can actually eliminate them for them because they didn't know they qualified for a program they should have been put in before they actually had the event. And then second opinion and advocacy services for ongoing conditions are where we're going to have the biggest impact. And bonus coverages. Who doesn't like extra, right? So whether it's our savings program for prescription drugs, which can be bolted on to your existing health plan, and to give you extra savings, we can provide many, there's over 200 digital healthcare benefits that we've added into the Safe Harbor program that don't interfere with their existing health insurance. So one of the things we try to do to make it easy is not interfere with what's already in place. People love Blue Cross, United, or Cigna. I don't. They might. They'll learn to not like them the way I do, but they're happy with what they have, right? That's always what they say. We like what we have, we just want to save money. Well, we can help you with that as well. So what is the solution to total wellness? Our approach is to reward people, to gamify it, to make it easy and simple to understand, and incented so that they'll actually do it. Safe Harbor specifically addresses individuals' behaviors, the largest factors to impact your health. What does that mean? It means that we're taking the data that you gave us willingly and just bothering you about the things that you told us you wanted to be bothered about. So whether it's a text message because you haven't interacted with the life or the health coach in a little bit, or it's a email telling you, hey, you didn't take your medicine this week. We're just providing that next level of personal support that will actually get people engaged in their care plan. So what does that look like? Well, here's Jessica. She's a 40-year-old with high blood pressure. Some of the easy steps she can take that are prompted by our system after she took her health assessment would be to limit salt intake, increase her physical activity, and drink in moderation, which does not happen when you're here. So, what we can show her over her life expectancy is by attaining these goals, she can reduce her health care spending in retirement and, in essence, add almost $250,000 to her savings by using our program. What does that look like? We're connecting their health to their wealth by monetizing their achievements in healthcare. If they improve their situation, it shows them, hey, you've saved this much money, and then it asks them actually if they want to take action. So financial advisors and professionals can actually get contact from their customers based on their customers' healthy rewards, and the customer putting their hand up and saying, hey, I'd like to talk to you now because I would like to use that savings to improve my situation. Realizing your potential. Obviously, our unique projections are created from a health profile and lifestyle management system. We have a personalized action plan for everyone. The action plan is automatically integrated into our Healthy Capital goals. So it's set forth right on the screen, and we give you a nice, easy track gamification. As you can see, the target down the bottom tracks how many times you've used it, and then when you get to the minimum requirement, it lights up and it gives you a little badge. So people seem to really like that piece of it. The virtual coaching, again, this is to engage people where they are when they need it. This is going to be AI driven, but there is also live people behind it so that you can get instant answers, but you can also get more thorough answers with a personalized consultation. And get smart about savings. This is really something I like about our program is the integration of the financial piece of this to help you prepare to save for your future. Your retirement income can be a snapshot with a simple circle and give you suggestions on how you can log in every day to try to help improve that situation. Tracking so we call them qualified medical services or QMSs. Everybody shortens everything in our industry, so I have to tell you what it is before I start saying QMS, qualified medical services, again, where all you would come in. They hit their minimum targets, but again, we're making it easy. It's, you can log in and tell exactly how many they've done, what they need to do to improve, and the resources that would be one touch below that so that they can get it done. What do we do for tracking? Fitness integration, monitor your workouts, tie it directly to the doctor's records and our EMR so you can share it with anyone you choose to. We have an administrative dashboard for the employers so they can target demographics for improvement. And really, there's over 530 million pieces of actuarial data that were used to build the analytics that this system uses. And to be honest with you, it's very, very thorough and impressive. I come from the healthcare background as a consultant. I could tell you if I had had this tool when I was selling healthcare, I would have been much more effective at negotiating renewals for my clients. So the engine, wondering where does all this information come from? How do you expect all this? Like I said, there's 530 million pieces of actuarial healthcare data put together by our team. It calculates the average lifespan, your healthcare costs based on your conditions, and the opportunities for savings that we can present by using our technology to nudge you politely to get into your care plan. So in conclusion, tech has definitely evolved, but there is so much out there that people are confused, basically. They don't know which one to use. They don't know why they want to use it. They just know that they should start using it because the next time we have an interruption in our lives like this pandemic, it'll be a lot easier to adapt. But for you in this room, if you take advantage of this time, this willingness in the consumer to take that first step into something different, you're really going to see great results as we have with our partners. Oh, and I think I just shut it off. So I appreciate your time, folks. If anybody has any questions, I'm happy to answer them. I hope you enjoyed the conference as much as I did. I'll see you all later.
Anybody have any questions? Well, I'll just say our program is typically for the group, market businesses with employees. Is that all? Yeah. All right, I can barely hear myself. But that's our market. So if anybody out there has products or services that you're offering in that specific group space, we should definitely talk after. Because like Ryan was saying, the average savings for them, obviously incentivizing people. The most powerful one is that on average we have about $150 a month each employee has that we give back to them actually in their check. And not like at the end of the year, not when they do something, in their check from the first time they run payroll. So if you get paid weekly, we put that money in your check. That money is there, it's utilized, they can do anything they want with it. They can go gamble, or there might be something that you're offering out there that could be of value. I know a lot of people like accident plans and disability, so a lot of insurance brokers have really, come and embrace what we're doing for twofold. One, it helps with everything that we just went over, but also it gives them the ability, employees out there, to actually buy some of these benefits that they typically can't afford to, with money that does not affect their take-home pay. And that's like the big draw from, obviously that's a different discussion on how we do it, but that's the most attractive thing that's brought people to use our program. And then of course engagement goes up dramatically. Yep, that's me going through puberty again. Dramatically. But, what is it,
77% participation within our employer groups. So the message is resonating. What they find out that by accomplishing some really easy to use, introducing themselves to using telemedicine, they can save $154 a month when the average person doesn't have $1,000 in their checking account to pay for an accident. That $154 is a really good reason to engage in some healthy activity.
Yeah. So either they're doing it for the money or they're doing it for the health, but either way, it's a good thing for them.
Just a quick question, since you're paying attention to the demographics, what age group do you have a break-off between will use digital and what will not use digital?
That's a very good question. Generically, the baby boomers are the generation that's heels in the sand being dragged into the digital transformation. I'm 43. I'd say it's about 5 to 7 years older than myself, so right around the 50
Late
plus.
50s.
Yes, exactly.
Yeah, question, just to add to that, we see it in a twofold. A lot of people like desktop version of what we have, and then the younger people like the mobile experience. So, but they're using it anyway.
Yeah, we do like the data. So breaking it down, over 50 uses the desktop version 94% of the time. So they're not quite on their phones yet, but they're still engaging with the technology, which is the first step.
All right, thank you.
Thank you all.